I'm Dr. Dane Donahue, and I'm sitting with Reverend Sheila Pierce, my good patient, and I want to thank you for being on. I wanted to ask you a couple of questions. First question is, how did you learn about our office, and what was your interest in our office and in wellness and the services that we provide?
I first heard about your office by way of an ad. A friend of one of my congregants actually showed me an ad in one of the weekends.
Okay.
And that really piqued my curiosity. The 8 weeks of wellness is what really triggered me because of the period of time that it spoke of.
Okay.
And then it listed different things that I could change some of my other behavior. And it just brought me back to maybe a balance.
Sure. And what as a result of doing 8 weeks to wellness, because that's great, because it's really, it is our message is trying to get people to change their behavior. Because wellness, we believe, is behavior. It's a mindset that leads to behavior, leads to an outcome. And so, what were some of the outcomes from doing the program? And you did it a while ago, and you continue to apply a lot of the same strategies and behaviors. So tell us about the program and what it's done for you.
I have I almost want to say it this way, almost a perennial problem when I look at my weight. And so that's what I really went there for. But what happened was that my blood picture, my labs, changed remarkably. So much so, I remember doing this. I had just had some lab work done. I was on statins, some medication all of it. And I had done lab work about 3 months prior to starting 8 weeks. And then we did starting level with 8 weeks. And then we did at the end another level.
Right.
This was so dramatic. I remember writing this up. I gave everybody a copy because my blood levels, the labs, had shifted so remarkably, surprisingly.
Right.
And so for me, that was a big imbalance, getting back in that.
Yeah, and knowing that maybe you could start to decrease some of your medications because your behaviors were now driving physiology instead of medication.
And actually, I even took myself off of my medication.
Wow, very cool.
So
what advice would you give to somebody who is thinking about the program or maybe is interested in wellness?
I would really tell them to first come over to find out the full picture of what the program has to offer. It's that introduction, I think.
Sure.
That
orientation.
The orientation. That's the greatest part of it all.
Sure.
Because it really lets you see what the possibilities for your own track.
Sure. That's fantastic.
Yeah.
And we may use this in another form, so I just want to know if we have your permission to use this for educational purposes.
Absolutely.
Well, I really appreciate it, Reverend Sheila, and I look forward to taking care of you in the future.
You will. Yes. Thank you.